two cases with two different problems, but the one approach. The approach that I use a lot in my setting, I will use the facial rejuvenation 360-degree approach, and I use it from this paper. From this paper, they conclude that to do this approach, we need 4 pillars of the facial rejuvenation. The first one, we have to understand our patient deeply. The second one, we should do the holistic facial assessment. The third one, after we do the holistic facial assessment, we should do the combination of the treatment and design it customized for our patient. And the fourth one, to develop the long-term or the maintenance plan for our patient. In the detail, the first one, for the patient understanding, we have to be the active listening. We have to look at the emotional or the body language that they express, even the speak or non-speak, spoken or non-spoken. We can use the open-end question like what and how. How do you think if we can improve the condition of you, or what do you think, something like that. And after you use the open-end question, you have lots and lots of information. Now you can use the direct question to conclude, to be more specific with the yes or no. And then you conclude and suggest to the patient. The next one, the second pillar with the holistic facial assessment. You have to assess the facial shape, evaluate any dynamic effect with the facial expression. You have to assess any asymmetrical or facial balance, and use the light and shadow effect, especially when you want to treat the acne scar. And then, and then the third pillar, we go for the leverage the treatment plan. The first one, we have to select the treatment modality, and normally I will use the combination one. And we have to sequence the treatment, what to do before and after. And the fourth one, we have to plan the long-term treatment plan for our body, our patient. We have to we have to outline the optimal treatment plan to ensure that our patient understand why we have to do the maintenance or the proposed plan for our patient, and let them choose what to do and what not to do. And if we need to change the plan, we should be able to revise it. In the combination treatment, how I do it? I do it layer by layer strategy, because we all know that when we age in every layer, from the epidermis, dermis, the fat, the muscle, and the bone, which each aging layer have different treatment modalities. We can do it from superficial to deep, or maybe from deep to superficial. Depends on the problem of our patient, depends on what our patient needs, and depends on what treatment that you are going to use. I will move to my case. I will show these two cases. The first one, she is a Thai female in her 58 years old. She come to me, she said that she needs 1 cc of the filler into her nasolabial fold. And when I asked her that why she wants to do the filler, she said that because she feels she look old, she look aging more than her friend. So her friend told her that she needs the filler and she needs to come to see me. And she has never do any injection of the filler before, so she is very afraid. So I moved to the holistic facial assessment. She is the sacker type due to the paper from Arthur Swift. It means that she has the tissue drop and the fat bulb. And she also has the periorbital hairlessness, the downturn of the mouth corner, and pore dilatation and mean poor skin quality. Then I moved to pillar number 3 and pillar number 4. For the first visit, I plan to use the filler to give her the immediate noticeable result. So I augmentation with the Nivea filler and Nivea stimulate, combining with the thermal lifting with energy-based device called Safiro. Then the second visit I plan to do 2 weeks after. After she get more trust for me, I plan to do the skin quality enhancement for her with the laser me, which is the energy based device for skin improvement of the texture. And I will use the UV Hydro Deluxe to do the biorevitalization for her. And for the long-term treatment plan, I plan for her to do the Savio combining with Lesami and Nivea Hydro Deluxe for 3 sessions with 1 week in tour. And about the Nivea filler, it is the pegylated HL filler, so it will give the thermal stability, the good viscoelasticity with low immunogenicity. And it combined with the calcium hydroxyapatite. So the calcium hydroxyapatite is the physiologic collagen biostimulator, and it has the glycine and alkaline, which is the amino acid that will give these filler to maintain good osmolarity, and it will decrease initial swelling. About the thermal stability, here this paper, it concludes that even with the high temperature up to 50 degrees Celsius or low temperature at minus 20 degrees Celsius, the pegylated HA still have the good rheology compared to the other treatment, to the other filler. And about the osmolarity from this paper as well, it concludes that in addition of the proline and glycine, it will reduce the initial swelling capacity, and it will also increase the hydration and softness of the tissue. And Safiro. The Safiro is the machine that have 2 functions. The first one is the infrared collagen stimulation. It will give the skin tightening effect, and it can decrease the fine line and the wrinkle. And it has the Smart Hydro. The Smart Hydro is the deep cleansing, gentle exfoliation, and with the lymphatic drainage. The result after doing the Safiro infrared biostimulator treatment, it can increase 40% of the fibroblast activity and result in the increase in elasticity of 25%. And with the Lesami, the Lesami is the non-ablative skin resurfacing treatment with the diode. It will give the skin rejuvenation, skin resurfacing. We can use it for any atrophic acne scar, any pigmentation. And the reason why I love this machine because it has very, very less pain. Some of my patients don't put on any numbing cream compared with the other device like fractional needle IF that we use to treat the pore dilatation or the skin atrophy. Here is it a non-ablative fractional diode laser with the wavelength of 14 and 17 nanometers. It will penetrate into your skin about 400 micron, and we can adjust the fluent and the pelvic. And it will have very, very little downtime here. I use the microscope to see the scabbing of the laser treatment here at day 3 after treatment. Very, very few scabbing. Actually, lots of my patients, when I ask any scabbing, any class, mostly of them, they report that they barely see. Only when they apply the makeup, they might notice that some of the flake there. But for the men, they said that, oh, nothing happened to my skin at all, doctor. And this is how we can use the machine. Here at the tip, it has a sensor, it has basic one, and the advanced one. The basic you can adjust only the energy pulse, but the advanced one you can adjust the spacing and the energy. It's very easy to do, and it's very fast. After a little bit of the redness, as you can see, not too much. The redness and the swelling here will go within only no more than 2 or 3 days. Normally, I will use the exosome apply immediately after the treatment to reduce the redness. Then I do the injection of the, here I use the Nivea Hydro Deluxe to do the skin biorevitalization. Use the sharp needle, okay? And the treatment plan in this lady, I use the intensiology here for the stool, and I use stimulate. It's a pegylated HL filler with the CAHA at the jawline formation and the submandibular, subzygomatic area. I use intense LV for chin augmentation, and for nasolabial and the lips, I use intense rheology. And for Saphiro is the infrared one. Saphiro, I use 2 passes for her. I use 3 passes. The first 2 passes, I use full face treatment in the area of horizontal and then the vertical. And then in another one later part to do the lifting. And this is the result before and immediate after doing the injection of 5 cc of Nivea filler and the treatment of Saphiro. You can see at the oblique view the lifting effect from both Saphiro and the Nivea filler injection. And second visit, I use the laser me to do the whole face, the one that I show you in the video clip. And then I inject the Nivea Hydro Deluxe. And this is the result before and after doing all the treatment for her. You can see that improvement of the skin quality, her skin look more brightening, and lifting effect here. Very nice, very natural. Here, the pore, the wrinkle, also with the whitening effect because of the calcium hydroxyapatite has some brightening effect on the skin. Then the second case, she is a Thai female in her 44 years old. Actually, she came to me, she said that she always look angry. So she wants to inject the filler into her lips to improve the lip shape. But I look at her, she has the very, very sunken. So she said that she has rapid weight loss from injection of the magic weight reduction pen. So she lost 40 kilo in about one year. So the type of the patient like this, we call it Ozempic face. And she has low self-confidence. She said that she's always been shabby. Her weight has been increased to about 100 kilo in this picture. So when she take the picture, she always hide behind her friend. So in this case, she is a single type, not like the first one. So she has the hollowness and the descent with the upper eyelid dropping it, and the downturn of the mouth corner, so she always looks angry. And she has very loss of skin elasticity, pore dilatation, and melasma. In the first visit, I always start with the filler, something that can give the immediate result. And in this case, I use the thread to do the lifting of the eyebrow and combine with the Saphiro. And second treatment, I do the skin quality enhancement. And the fourth visit, I plan like the first case. This is a treatment plan with this lady. For the thread here, I use the N-Corp multi use with the reinsertion technique I will show in the video later. I use 3 threads per side. The end-top multi has a small size, 2 0, so it is very small. So I feel very comfortable to use it at the eyebrow lifting. And it has the multi-directional, so it won't cause any skin dimpling. And this is the treatment plan for the filler injection here. Okay, and for the lips, I prefer to use the sharp needle. I will show in the video demonstration later. Here I use the intense rheology for lip augmentation, and this is the video demonstration. First, I inject with the cannula into the interfacial plane with a linear little blade. Then I use sharp needle for the intense to do the ligament lifting of the zygomatic ligament set out and zygomatic cutaneous ligament lifting here. Also with the sharp needle. And improvement of the Babcock maxillary ligament. Then I use the blunt cannula into the soft area. Touch on the bone. When I treat near the eye, I will ask my patient to open the eyes. And I use the blunt cannula to do the subzygoma here. And I move to the nasal review for in the subcutaneous plane. And then the jawline enhancement, I use the blunt cannula into the subcutaneous plane here. I use sharp needle for the lips to do the projection and volumization to do the lifting of her mouth corner. Also with the lower lip here, I use sharp needle into the submucosal area. Also the same in the other side. Then I do the improvement of the cupid bow with a sharp needle. Really, speed of the field not that much because I don't want to elongate that. Then I use the blunt cannula to do the myomodulation of the chin area and for the chin augmentation. In this case, I didn't elongate her chin. Now I move to the thread. The end cap with the reinsertion technique. We cut and reinsert. With this technique, I use only 3 threads, but it equally to 6 threads with the re-extension technique. And it can lift the eyebrow up very good. For the eyebrow area, I will do the over treatment, but don't be worried, within 2 or 3 weeks it will go out. Okay, so I finished. This is the result before and after doing the treatment of filler injections, Staphylo, and the thread. You can see widening of the eyes. She doesn't look angry anymore. The result immediate after the treatment there, the lifting effect. And this is the result after doing all the treatment for quality enhancement for her. Okay, before and after treatment. So in conclusion, with the four pillar of 360-degree approach with this all, we are about the facial rejuvenation. It's not only about the beauty, but we need to give our patient more self-confidence so they no longer have to hide behind their friend anymore. And I think that's the key important in our job. Thank you so much.
Thank you, Doctor, for these two interesting topics. So, is there any questions?
Do you have any questions? So I think we can move to our next speaker.
So our next topic will be the smooth and radiant transforming scales and relaxing skin with an microneedling RF, Thulium laser, and Asian booster. It is my pleasure to introduce Dr. Mei Lam Mai. She is a general practitioner in Hong Kong with 30 years of experience in aesthetic medicine. She also got a master in clinical dermatology in the UK. She also skilled in injectable drug lifting, laser, and body contouring. And she also has co-founded the Hong Kong Medical Aesthetic Association, where she served as a president for over 5 years. And she also has authored a book on aesthetic medicine and is an international trainer for many leading products like Listerine, Scatter, Dysport, and Freedom. Please join me in welcoming Dr. Mei Lam Mai.
Thank you for your kind introduction. I'm Dr. Mei Lam from Hong Kong. And yes, so I'm very happy to be here to attend the ISAH, and it's my honor, and very happy to see a lot of new faces and old friends. And today my topic is about acne atrophic scars. I think acne atrophic scars we handle very frequently, but it's not usually a main concern for clients because those are mainly from men. So our customer base, for my case, our customer base usually is 90% women. The remaining 10% is the men who are grafted by their girlfriends or wives. So atrophic acne scar may be not our top priority for the aesthetic treatment, but however, when we have machines and injectables and every treatment set in hands in our aesthetic clinic, actually we can offer a better option for those who suffer from atrophic acne scar. So this is today's topic. I'm using three modalities in treating the acne atrophic scar. One is microneedling RF. The second one is fractional thulium laser, which is a non-invasive 1927 nanometer. And the third one is HA skin boosters. And I also have 6 cases in the later part that I can share. And 6 cases is a case series that undergo 3 modalities or 2 out of 3 modalities in treating their acne atrophic scar. And okay, I think I have to sing again. Yes. Okay, for acne atrophic scar, that we all we know that we have several types. So which is ice pick type, a narrow and deep one, and we have a more shallow one, which is a rolling scar and a box scar. And we also have hypertrophic scar, which is can be keloid or just simply hypertrophic whitish scar. And we can have flat scar, which theoretically is not scar, but is only pigmentation after the acne, which can be hyperpigmentation or erythema after the inflammation. So, so it's running. And for the measurement of the scar, acne scar improvement, actually I'm using the qualitative acne scarring score adapted from the Goldman and Barron's scarring system. So there is 4 grading of the Goldman and Barron scarring. So the first one is the, I don't know why the slides pass through so quickly. So grade 1 will be macular disease, macular grade, which is flat with only pigmentation. The grade 2 is mild disease, which is not noticeable atrophic scar or hypertrophic scar in social distance. So what do we mean by social distance? Is 50 cm from we face when we talk, conversation within 50 cm. That will be social distance. So for mild grade, we will be not that noticeable, or can be covered with makeup for female, or can be covered with beard for male. And for the severe grade, so for the grade 4, which will be most severe one, and then it is very noticeable in the social distance, and it can be not cannot be covered with makeup or with beard. So we will be quite embarrassed when we have conversation with others and with the social distance, and the acne scarring will be noticeable. So that will be grade 4. So we can think of when we go to the secondary school or when we are teenager, how many of us have friends or friend that suffer from acne? Even nowadays, when we are seeing daily our dermatology cases or aesthetic practice, we still see a lot of cases that suffer from severe acne that not only affecting the appearance, but also affecting their social life and even the self-confidence. And this acne vulgaris is not actually just a disease, but we will leave some scarring, and the scarring could be permanent, and then it can be lived to adulthood. And even in the later life, that I have a case that is in his 50s already, and because of aging and fat loss, his acne scar become more severe. Okay, thank you for the technical support. Okay, so the slide still. Oh, okay. Sorry. Yes. I can do it anywhere where the slides are just like a random pick. Okay. It's too fast. Sorry. So we talk about the atrophic acne scar. So we have the ice pick, which is narrow and deep, and we have the more shallow rolling and posca, and we have the hypertrophic scar and pigmentation. Okay, now the slice is not jumping. So why we need three modalities in acne atrophic scar treatment? That we have to dig into what is acne scar and how does it look like under the histology. Recently published a paper which is a cross-sectional pilot study using a histopathology studying on the multiple sample of acne scar including box scar, ice pick scars and rolling scar. The finding is actually quite interesting. The next slide please. They actually find the mean depth of the ice pick scar is actually deeper than we think. The mean depth of the ice pick scar is actually the 1,900 micrometer, which is nearly 2 millimeter. And 2 millimeter, what's the concept of 2 millimeter? Actually, our skin thickness is already 2 millimeter. So the ice pick scar is actually the thickness of our skin. And why it is important, I will explain later. And then the box scar and rolling scar is a little bit more shallow, but it's still deep. It's 1,300 micrometer, which means that for this kind of deeper scar, we have to treat deep. For those laser who cannot treat like this deep, maybe not effective enough. Next slide, please. And then when we see the dermal layer of the scars, 70% of the dermal layer of the scar and has shown that there is a fibrillar collagen derangement, which means there is a loss of collagen and loss of dermal thickness. And more than 90% of the acne scar also show there is a loss of elastic fiber, which means we are not only treating the irregularity of the scar, we are also treating the dermal change of the scar. And then if the treatment we are already providing is too superficial, not reaching the dermis, or even the superficial subcutaneous layer, that may not be effective. So we have to combine multiple treatment because the scar is deeper than we think, and the scar has dermal change that is more than we think. And for this kind of combined treatment, I'm utilizing in the middle is a microneedling RF, which can tackle a deeper layer and the collagen, the dermal layer, and even the superficial subcutaneous layer. And for the fractional thallium laser, it can tackle the superficial skin resurfacing. And for the Restylane Skin Booster, it's actually for the localized severe acne scar. So three modalities for acne atrophic scar. When we treat deep, we are using the microneedling RF. When we treat the superficial layer, we are using the fractional thallium laser. When we treat the localized area, we use the Skin Booster injectable. 6 cases were recruited in the study, and then they are undergoing 3 steps. 4 out of the 6 patients are undergo all 3 modalities, and 2 out of the 6 patients undergo 2 modalities. First step will be multi-section of microneedling RF, and the second step will be fractional thallium laser, and the last step will be HA skin boosters. So the outcome is measured by the Goldman and Barron's qualitative scar rating scale. So grade 1, as I explained, is the macular disease, which is no hypertrophic or atrophic scar. Grade 2 is a mild disease which is not noticeable in social distance, while grade 4 is a severe disease that we can notice in social distance. First step, we have to tackle the deep scar and the dermal change. So we have to do the collagen remodeling. So I'm using the microneedling RF system, which is deep. The depth is 2 mm to 4 mm. And the needle is 24 pin-coated microneedles. Comparing with common microneedling RF, which is the RF energy is transmitted in between the tip of the needle, this in-mode system, actually, next slide please. This in-mode system Actually, the RF is transmitting in between the skin surface and the tip of the needle. So you can see the area of the green is larger than the previous slide because the transmission area is larger and the heat and the involvement is bigger. So it can treat for deeper, more multi-layered treatment. Yes, please click the. So this is treatment video. The patient is under topical anesthesia and cold air for the comfort treatment. So he was treated with multiple layer of microneedling RF, first 4 mm, and then 3 mm, and then 2 mm for the full face. One can appreciate the immediate erythema after the treatment and a little bit edema also. Next slide, please. So second step will be the skin resurfacing using the thulium laser. The thulium laser is the 1927 nanometer, which is in between CO2 laser and 1440 nanometer laser, which means the heat that it generates is not too much. For CO2 laser, it generates too much heat. For the 1440 nanometer laser, it generates too little heat. So it's in between, and it's a non-ablative, which means that the skin surface is intact, and the downtime is relatively short. This is the histology of the skin treated under the fractional thulium laser. One can appreciate the top stratum corneum is intact. For the middle part is the epidermis, and the lower part is the dermis. And in between the epidermis and the dermis, there is a gap created, which is the wound that created by the laser. And the upper part of the dermis is a little bit red, darker red. So it also has coagulation in the upper dermis area after the thulium laser. As the thulium laser is targeted on water, so it's pigment blind, and we can use this machine safely in all physiatric skin type, including type 5 and 6. By creating the wound in between the dermal and epidermal layer, we are not just talking about the resurfacing of skin, but we are talking also about the increase in the transepidermal topical medication delivery, which means that anything that we put on the skin after the laser can be absorbed better, more efficient, and longer, because the wound in between the dermal and epidermal layer actually can last for until 2 weeks. Therefore, we can imagine if we put on the either exosome or PDRN or peptide or growth factor or anything that can help the acne scarring, can be put on after the laser, and it can be effective up to 1 week. So this is the treatment model, and she was also put on the topical numbing cream, and laser was emitted in a random mode and with a rolling tip. So for practitioner, which is really easy to use, and treatment will be quite quick, and effect will be quite even. So after the treatment, there will be a generalized erythema similar to fractional RF, but the duration of the erythema is shorter, usually 2 to 3 days. Comparing with microneedling RF, will be the redness will last usually 3 to 5 days. Okay, next slide, please. So the third step will be localized injectable HA skin booster. For this case, I'm using Wrestling skin booster, Wrestling Vital and Wrestling Vitalite. Vital and Vitalite are using the Nasha technology. So what is Nasha technology? It's a very traditional, very established technology, non-animal stabilized hyaluronic acid, and is what is the specialty about it? Because it has natural entanglement within the cross-linking HA, which means that the synthetic cross-linking is about 1% or less, which is much less than other brand or other series of HA. So we can use the micropuncture technique or short linear or linear technique or the fanning technique. The treatment placement will be just subdermal, very superficial. So this is a smart click system. What is a smart click system? Actually, you can hear a click when we inject 0.01 mil of the syringe. So one can imagine 0.01 mil is really small amount, and we actually basically cannot do it manually, right? But with this smart click system, we actually can hear the click, and then we see, okay, this is the 0.01 mil droplet. And then theoretically, we can use 1 mil syringe to treat 100 acne scars, theoretically. So we disinfect the area, and this patient just right after the Morpheus, the microneedling RF treatment, we can use the 29 gauge needle and baffle up. And when we injecting, the layer of injection is actually very superficial, and one can see the temporary irregularity afterward. And we can do a little massage after the injection to make sure it is evenly distributed. Okay, next slide, please. So this is the first case. She's a 33 years old lady who has grade 3 moderate disease to start with. Her acne scars mostly focus on the central area, the glabella, the nose, and the chin. So she has multiple ice pick scar at the glabella region, and hypertrophic scar at the chin, and also the acne papule that is on and off. And she received multiple sessions of microneedling RF, and then the fractional laser in between, and then finally the fractional thallium laser with the skin booster. This is her treatment modality for the fractional RF. She received 4 mm, 3 mm, and 2 mm multi-layer of the microneedling treatment. And next one is the energy setting for the fractional 1927 laser. And this is a treatment protocol for the HA skin boosters. And before and after. Before the treatment, her grading of the acne scar was moderate disease, which is grade 3. And after the treatment, she already improved to grade 2, which is mild disease. One can appreciate the acne scar on the pores and the glabella and the mid-cheek area. And also the chin, the irregularity and the hypertrophic acne scar is also improved. Using the 3D spectra, the 3D photography system, one can appreciate the features count has been dropped from 982 to 977, which means that her skin becomes more smooth and less irregularity. So the second case is a 56 years old gentleman. He has mild disease to start with, and he also complained that his face is sagging and with a double chin. So I choose only the radio frequency microneedling for him without the superficial resurfacing, because the microneedling RF also can improve the sagginess and the double chin and the jawline area. So this is his energy setting, and then we can go through next slide. And this is the before and after, and he can appreciate the lateral cheek area. There's an increase in skin texture and smoothness, and decrease in pore size, and also the surgical scar at the glabella area also improved. And the Barron score has been improved by 1 grade, and feature count has been improved. And well, it's too quick, sorry. And the third case is a 35 years old gentleman, and he has a moderate disease to start with. Yes. And then the acne scar mainly focus on the temple area, the bilateral temple area. And also he has some pigmentation issue, and with the erythema at the lateral cheek as well. So he received multiple session of microneedling RF and multiple 2 session of lasers and then 1 skin boosters. And then we can go to the final result. So this is the before and after. Before the treatment, he was grade 3 moderate disease. Afterward, he was rated grade 2, dropped to mild disease. And the temporal area still have noticeable acne atrophic scar, but the irregularity has been improved. And also the other side. Also the skin tone has improved. With 3D spectral photography, one can appreciate the irregularity of the lateral cheek, and the temporal area is also improved. And the features count has dropped greatly from 12,000 to merely more than 5,000. So his general skin texture has been much improved. So case 4 is a severe case. He has a grading of 4 severe to start with, and his acne scar is actually very noticeable, especially when he got older, and recently he also had some weight loss, and then he complained that the face looks a little too much irregular. And this is the before treatment. And I did ultrasound for the thickness of the skin at the cheek and the submental area. So this is the cheek thickness, and the thickness of the skin is 2.07 millimeter. And he received multiple sessions, 6 sessions of microneedling RF, 1 session of lasers, and 3 more sessions of skin boosters. So for more severe disease, you need more treatment and more treatment price and more money to invest. And this is the treatment modalities. Yes, we can go to the after picture. Yes. And this is before and after. And his qualitative acne scar scoring has been improved from grade 4 severe disease to grade 2 moderate disease. So which is a much improvement. And in social distance, he no longer complained that he was too irregular on the face. And this is the other side of the cheek. And at the temporal area also improved. And with 3D picture, we can see the irregularity of the face has been improved. And this is the other side. The features count has dropped markedly from 14,000 to 9,000, which means the general smoothness and skin texture has been improved. So we have also the ultrasound is surprisingly noticed that the skin thickness has been improved from 2.07 millimeter to 2.43 millimeter after multiple sessions of RF and lasers and skin boosters. So mostly I think the skin thickness will be improved by the skin booster itself. So this is the 5th case. Is a 38 years old gentleman with moderate disease to start with. And maybe we can jump to after, before and after. Yes, and this is the before and after. After the treatment, his grading improved from grade 3 to grade 2. And also the glabellar fine lines has been improved together. And large pores and irregularity has been improved. And features count also improved from more than 3,000 to around 1,000.